I'm Dr. Danny Clark. I'm the new Director of Orthobiologics here at Protea, and I wanted to walk you through today a little bit about what makes us different as a clinic offering orthobiologics, or what's commonly referred to as regenerative medicine. Our number one priority as soon as we start working with you is to come to an accurate and solid diagnosis. If we don't get that diagnosis correct in the beginning, when we do these injections or these procedures, we're not going to make any progress. And so my ultimate goal is to spend a lot of time with you going over your injury history, your surgery history, and what bothers you on a day-to-day basis. We can do in-office ultrasound imaging. We may send out for some advanced imaging like MRIs or CTs to really narrow in that diagnosis and see what's going on and causing you pain. Because when it comes to these procedures and I'm injecting those structures that are injured, the goal here is to stimulate that tissue to heal again and ultimately relieve you of the chronic pain that you've been in for so long. After we come to that, accurate diagnosis, it really comes down to a high quality injection procedure. And there's a few things that factor in here. One is the actual inject date, or what we're injecting in you. With orthobiologics, the unique thing is that everyone is a little bit different. Because we're taking tissues from you, so your blood, making PRP or platelet-rich plasma, or we're using your stem cells from your bone marrow or your fat tissue, everyone has a different baseline level that they're starting from. So we'll take PRP, for example. When we're drawing your blood, we're taking those platelets, we're spinning them in a centrifuge, and we're concentrating them. Someone may start at a platelet concentration of 150,000, and some may start at 250,000. So what we need to know is where you're starting and then how much blood we need to take to be able to concentrate that down enough to get the healing response that we're looking for. So an example I like to give is when you have a migraine or a headache and you want to take Tylenol for this headache. If you take 50 milligrams of Tylenol, probably not going to fix your headache or your migraine. But if you take 500 milligrams, it probably will help. A similar principle applies when we are using PRP. For example, in the knee, if I inject 1 billion platelets, you're probably not going to get any relief. But if I inject 10 billion platelets, there's really strong evidence showing that you're going to get long-term relief of your pain from, let's say, your osteoarthritis. And so what we do here is we actually have a hematology analyzer in our clinic where we can draw your blood and we can test the PRP once it's made to see exactly how many platelets are in that solution. So when I do my injection, I know exactly how many platelets are being delivered to that area of injury, thus giving us the best possible outcome. The other piece to this here is that we do everything under image guidance. So that's a really important thing for both efficacy and safety. We use an ultrasound machine, which allows us to see the tissues, see the structures in real time, and I can guide my needle under this ultrasound image guidance to that exact area of injury inside the joint. And so I can know for sure that when I'm doing my injection that it's going to the exact right area that's causing you pain, and it's going to give us the best possible chance of a good outcome. We also do all of our procedures in a sterile field. What that means is that everything on the procedure table, your skin, all of our instruments are completely sterile. And so that reduces the chance of any infection risk and anything like that that could potentially cause you harm. That's also the reason why some of our injection procedures may be a little bit more expensive than what you're used to seeing out there. And so I often get asked why our procedures are, say, $1,500 for a knee injection procedure versus they go to their orthopedic surgeon who's offering the same thing for $400. It's because we take these extra steps to be very thoughtful, methodical, and we focus on that safety and efficacy when we're doing these procedures. So if you're interested in finding out more information about our approach here, you can check out our YouTube channel, check out our website. We have lots of information on there. Or you can call the clinic and you can schedule a free 15-minute discovery call with me, and we can chat briefly about what you have going on. You can ask questions about our approach and whether or not you feel like you could be a candidate here and if we are a good fit to work together.